Welcome to another edition of Throwing Down Some Heavy Light. My name is Aljamal Binded. I'm the chair of the board of Movement Omaha for Race Equity. It's a group that deals with racism and anti-racism issues, as well as trying to challenge the apartheid nature of this community, and also to get more people involved in dealing with the disparities that exist between the various racial groups in this community. And so our goal is just to try to educate and, of course, bring people to community forums and to help bring people in the know to talk about those issues they otherwise don't get to talk about in some of the traditional medias. Today we have with us Dr. Donna Polk. She's a longtime advocate for Nebraskans and people of color, women's issues, and other racial issues in our state and our community. I've known about, she also wrote a book, and I've known about her book, African Americans and Their Contributions in the State. She wrote that a number of years ago. She has a PhD in psychology and has worked as an advocate for healthcare issues. We invited her as an elder in our community to share some of her wisdom and help some of these misguided people who stand on the shoulders of our ancestors who need to understand that we're not alone. We're reminded that we are not the beginning of the movement for Native Americans or African Americans and other groups. We call this episode, this particular edition of this Throwing Down Heavy Light, Histories and Issues of the Day, because some of us have not had a chance to talk to people who have been involved in the struggle for as many years as Dr. Pope. Welcome to Throwing Down Heavy Light, Dr. Pope. And first, can you share a little bit more about yourself with the participants?
Well, yes. And first of all, please call me Donna. We've been longtime friends, and I feel more comfortable that way.
Okay.
Well, perhaps people might be interested in the fact that I arrived in Omaha in 1964 when it was as racially segregated as it is today. We couldn't live in Louisville, Nebraska, because they did not allow colored people to live there. And my military husband was assigned there. And so he commuted rather, from Omaha to Louisville daily. And I moved to Lincoln in 72 and moved back to Omaha in 2000. And so I'm very, very proud to say that I'm the CEO of Nebraska Urban Indian Health Coalition, but I'm not representing them here today in case I say something that's very controversial.
I appreciate that. I understand this book you authored on African Americans, Nebraska, and Black Nebraska, and so on, some years ago. And again, your book has contributed to our understanding of African American history in Nebraska. And also, we know a lot of people move here, don't even know how many people live here are African Americans or what they contribute, and so on. That book, I think, throws out some light to many of our folks, particularly part of the state history that's not always included in textbooks, and it's somewhat dismal if you look at many of our history books in their school system. And again, maybe the audience may like to read about that. But could you share with us a little bit more what inspired you to write that book, particularly as a person who migrated to Nebraska? Some of us are native Nebraska, but you came in and you wrote this book about Black folks in Nebraska.
Well, it started I used to travel when I was the Equal Employment Affirmative Action Officer for the state of Nebraska. I was the first one to have that title.
Oh, wow.
And
I did not know that.
my job to travel the state. So I've been in all 93 counties. And I would often be invited to speak to the animal organizations, the moose, the elks, the eagle. No, seriously, or their auxiliaries. And typically they would say to me, the members would say in a very respectful way, are there any more colored people like you and that Chambers man? And I'd say, well, there may be others like me, but there's no one like Senator Chambers. But then I began to think about it, and it's like, I don't know that for real. So I got a small grant from the humanities organization, and I researched the book. I researched it. And I decided that I would pick people who had made contributions to the growth and development of Nebraska. So people will say to me, well, how come Malcolm isn't in it? Malcolm left Nebraska as a child, and he perhaps did work that benefited the United States and maybe the world, and not just Nebraska. Okay, so that explains that.
Gotcha.
So There are people in it that I didn't know about it. Matthew Oliver Ricketts was Speaker of the House when we had two houses, um, back before we had a unicameral. George Flippin was probably the greatest football player to ever play for the Bug Eaters who became the Cornhuskers. So it's people like that. Laverne Williams, people talk about theater. We had a theater in South Omaha that was named for her and the volunteer work she did around the arts. And so that, and Preston Love, I was able to know him. And now, of course, his son is contributing to Nebraska also.
Wow. So I know you and I have been in many meetings and community forums over the year. We're up in our age and sense, and you constantly speak about the forgotten minority. I've noticed that almost every time you're in a meeting and we're talking about racial issues, you always use that term to remind us, and some say Native American, so on. Why are you so passionate about that topic? And particularly over the years, for many years, you've been pushing that importance of that.
Well, because I'm so fortunate to have had the unique opportunity to work with Native people for more than 40 years.
Oh,
I started at the Lincoln Indian Center. Um, I had become a Buddhist because I hated my old job so much that a friend and a relative told me if I became a Buddhist, I could get anything I wanted. So I became a Buddhist, Nichiren Shoshu, and I said I would do that as long as I didn't have to wear one of those white outfits with the orange thing and shave my head. So they assured me I didn't have to do that. So I became a Buddhist, and 2 weeks later, I got a call about a job at the Lincoln Indian Center that paid me. I took the job. It paid me half of what I was making at the state, no benefits, and it was 9 month temporary job. And here I am today. So I consider myself so fortunate because, like many African Americans in this country, I have native blood, but I was raised as an African American. So I am so happy to have the opportunity to learn more about myself and others than I would if I had not had this unique opportunity.
right. Donna, one of the things we were talking about down the road and we're working on is many of our young folks, and particularly people who think they know, really don't know a lot of stuff by the behavior that's going on, don't know about our histories and so on. And I also ask the question, something like, if you had to write about your three most proudest moments doing social justice, and in Catholic charities areas of church, we use the word faith justice sometimes, and how you want to go at it. Sometimes it's sectarian where we just say human rights, as Malcolm used to say. Why are you so passionate about that topic?
Oh, I guess I never thought I was so passionate until I was stalked by the head of the Ku Klux Klan for Nebraska. And when I asked him why did he hate me and put a contract to have me killed, he said because it was who I was. And he got tired of every time he looked up, I was in the paper, I was on TV, people were listening to me. And I guess, Ajamal, I never looked at it like that. I
Wow.
didn't look at it. But that was such a life-changing event that now I don't do those things uh, like I used to,
Wow.
because I thought someone could become so angry that they would want someone to take my life. He couldn't do it because he was blind and in a wheelchair at the time. So, no, I mean, I laugh now and he's passed away. And so, one of the most interesting things was we had a reconciliation visit before he died. And so that was unique for me to have that opportunity.
Mhm.
And I think being a cancer survivor and talking to people about the health risk associated with certain behaviors and encouraging people to get screened and being a part of efforts to get people screened, I think that's probably good. And I do things to try to get more stars in my crown for when I was not a nice person.
One of the things in a recent discussion I had with a semi-educated non-reader, a Black Muslim, he shared ideas that illustrate his belief in the cult of personality. He also failed to understand that people can help us understand when they've moved to the spirit world. And those of us who are Africans know that very well. We talk about our ancestors, particularly. Um, if you were to speak of specific Native American leaders or credible messengers, who would you speak of known for their accomplishments? Maybe those who have passed, as we say, to the spirit world. Could you talk about somebody who's had a great influence on you in that sense?
Oh man, wow, that's interesting. Because I think my
Okay.
grandmother who passed away when I was 9 years old, she had brought me home from the hospital, which was her tradition. I had parents who were married. My dad was a sailor. My mom was a young housewife. I was their first child. So I often think of the things she said to me, Ajmal, or she wasn't talking to me, of course. She was talking to others, and I was just listening and didn't really understand. But she said something that is stuck with me. She said, in the last days, there will be wars and rumors of wars. There will be floods, fires, earthquakes, and people will be running to and fro. Now I knew what to meant, but I didn't understand what fro was. And in those days, you did not get in grown folks' conversations. So I couldn't ask. But I think I know what that means. So, and then from a contemporary perspective, someone who's gone on, I think it would probably be Reuben Snake. I had the privilege of knowing him.
Wow.
He's a very spiritual person, known internationally. He was Winnebago. And he prayed for a friend of mine who had a terminal case of cancer. And I felt so blessed. So that would be it for me.
Okay, good. One of the things that I'm disappointed, and I'll say this up front, is the inactivity or the incompetence, and say that very seriously by the outcomes and where we're at today. If you look at the data, someone said it would take us 3 centuries to be equivalent to whites. Again, you look at the home ownership, health disparities, all the money we've spent, things are getting bad. And again, some of us think things are getting better because we have a few celebrities and personalities out there who are getting high visibility. But if you add up our incomes and consider what we're going through, some would say as they say, the glass is half empty. So my question somewhat directed is, we're both senior citizens, we're over 50, 55, 65, so
Hey,
on.
hey, hey.
What disappoint? Oh, we can't tell age these wars. Okay, I'll speak for myself. I'm over 65 and so on.
Okay. All
And
right.
what disappoints me, and again, I'm throwing this out, it's kind of a loaded question a little bit, but what impresses you, and then the opposite of that, what depresses you, or what about our community youth, not only in dealing with African Americans and dealing with Native Americans? So in other words, are they good, bad, whatever, from your vantage point? And I want to be careful on how I phrase that so that there's positive and negative, but more constructive criticism more than anything.
Well, when I have the opportunity to speak with young natives, I say to them, they want the land back. They want the land back. The land that they thought was theirs, but never was, but they're after the land. And so we have to make sure that the lives of people is such that they will live long enough to protect the land. Come on. I mean, look at the wars around the world. It's about land. And the war against natives to get the little bit of land that is left for them has to do with, I think, the onslaught of drugs, alcohol, missing and murdered, high suicide rates, poverty. I was stunned to see that in parts of Arizona, people do not have electricity. And with heat in 3 digits, some of them have to resort to sitting in their vehicles with the air conditioner on because they don't have electricity to their places, their homes where they live. How can that be in 2024? Okay. So I try to always remind people that this is native land. I will ask students particularly, and I have the unique opportunity to speak to new medical students at both Creighton and the Med Center. And I say to them, do you know how Omaha, Nebraska was named? They don't know
Wow.
generally. I have people who work for me who have never been to Macy, home of the Omaha tribe. They've never been. It's 79 miles to the north. I mean, wouldn't you just want to go out of curiosity? No.
You know, Donna, it reminds me of the time you took a delegation. Matter of fact, that was my first time being to the reservation in my life. I spent 2 years in Africa and had a powerful and wonderful and transformative experience and learned a lot about the continent. And so when I went to, we went to the Winnebago and Omaha area and interacted. I thought I was on the motherland. I mean, it was the way they talk. Again, they being the majority, and most African Americans, people of color who have never experienced living in Nebraska, being the majority. It's like I don't know how to describe it. It's a euphoria. It's when you're in the majority and you have to deal with the racism and the evil viciousness and some of the stuff that it goes on every day. It's almost like you have a veil lifted from you. So yeah, I remember that day. It was a wonderful day. We went to a couple of meetings. I think there was a delegation of probably about 6 or 8 of us who drove up in that van, had a wonderful meal, and met different people. But again, I think anyone who lives in Nebraska, and again, one of my goals is to go to South Dakota, see some of the larger places, but it's an experience to be around Native people, learn about them. And again, I oftentimes share when I took my class at the UNL my freshman year or second year, and I had a real Native American speaker who was speaking about the culture. It was like day and night versus some of these imitation artificial personalities who read a book and consider them experts. And again, they've never lived in those communities. But yeah, I agree with that. It's very important. I want to switch up a bit and ask you about healthcare. So I know you've been really pushing healthcare for a number of years. Uh, what do we need to focus on in our community, particularly those of color, dealing with healthcare issues? And I know you've been on advisory committees, selection committees of people who've gotten key jobs at the university systems and medical centers and so on. But what do you think we should be focusing on related to health today, 2024, as people of color?
Public health.
Public health.
Public health. People need to be going door to door talking about the diseases that are killing us. They need to talk about syphilis, gonorrhea, chlamydia. There's been an epidemic of gonorrhea and chlamydia in Douglas County for the last 15 years.
Wow.
Now, according to the World Herald and other data sources, Black people, Native Americans, have syphilis at high rates. And I'm not a scientist, but I wonder, is there a correlation between the presence of dementia and syphilis in the African American communities? I
Wow.
don't know about you, but I don't remember when I was a little girl that there were elders that had Alzheimer's. And how could you mistake it?
Right. See, as you mentioned that, it reminds me, Donna, when I was on the board, I was the chair of the board of Charles U Health Center, and they had an advisory meeting, they had some community focus meeting, the issue came up of HIV, AIDS, and so on. And I remember one guy was complaining that he got his results too late, and he said, good thing he didn't do something, he could have infected someone. And I brought it up in a meeting and said, some of the things we got to be careful on and deal with is we got to talk about this. And in other words, you have to expose it for people to get healthy. It's like having a disease. If you don't know about it, and we see people dying prematurely, they don't have it. The other point I want to share is when I was on the board of health for Douglas County, most of those white folks who were on the board with me didn't want to talk about it. They didn't want to produce it. And as an advocate, I says, no, how are we as a community going to improve ourselves if we don't talk about these diseases? And then some of them came back and said, yeah, you got the same level of diseases in other communities, but the private doctors don't always report it, or else they keep it secret. And so again, some people felt they didn't want to report it in communities of color because they didn't want to stigmatize us or whatever. But again, it's like cancer, any other things. If you don't have it out there and deal with it and educate people, they're going to die prematurely of years lost, as we say.
Exactly. And some people see a conspiracy in all of this because there's talk of the fact that when Donald Trump is elected, they will work to eliminate some of the benefits that we have paid into, for example, Medicaid, Medicare, Social Security. They will raise the age limit knowing that people of color, and I shouldn't just say people of color, but Native Americans and African Americans specifically die earlier than other racial groups.
Right.
And
Yeah.
so
Go ahead.
we'll lose out if that happens. Now, and why I say public health, because we need to, if necessary, go door to door, letting people know there's a syphilis epidemic. We need to let them know that COVID is back. And I know it never really left, but now people have a new strain of COVID, and we need to make sure that we're tested, or at least we take preventive measures before fall when the new vaccine is available, for those of us who believe in the vaccine. And let me say something to you, Ajmal, on this subject. I believe so strongly in the fact that we must take advantage of healthcare that I remind people that at one point back in the 80s, there was an organization called Indian Chicano Health Clinics. And the Native community in Omaha had partnered with the Chicano community, as they were called then.
Mm-hmm.
And they, when I got this job, we had just a small clinic for OBGYN, and that was supported by CHI, or then it was Creighton. And then we had pediatrics for Well Child, and it became One World. And that really left Native people out or without culturally specific healthcare access. So when I figured out what had happened in Lincoln, I decided we would have the first, what I called at that time, a free clinic. Boy, that's when I understood how political this whole thing is. And so we talk about it, Ajamal, but still we don't take advantage of the opportunities to save ourselves.
Right. No, I understand. And it reminds me of three things that you just mentioned is we got to do. Sorry, go ahead.
Well, I wanted to make an announcement about a collaborative effort that's being organized by my good friend, Mark Darby. Mark worked or volunteered, and I'm not sure he got paid for everything he did at NOAA, North Omaha Area Health, which is a small nonprofit founded by Ira Combs. And so we're working collaboratively with North Omaha to have 2 health screening events related to cancer prevention. One is going to be, I think it's September 26th at Mount Calvary Church on Ames. That's a Saturday, and there will be all forms of screenings, everything from prostate, which is killing a lot of men of color, but for some reason y'all don't want to have that test done, but it's going to be available. Mammograms, lung cancer, and there may be another one that I'm leaving out. But then in October on the 26th, which is a Saturday, we will host that at our facility in South Omaha. And these are free and open to the public. So I want people to take advantage of the screenings, because there are a lot of opportunities for people to be treated for cancer if they know that they have it.
Right.
We're so fortunate to have the Buffett Cancer Center. Dr. Joanne Sweezy has replaced Dr. Ken Cowan as the director. They're both fine medical provider specialists. Dr. Sweezy has done research. She's worked with tribes. Dr. Cowan was my personal oncologist. He's a genius, culturally competent. and he saved my life. So we have to take better care of ourselves. Well, that's all I have to say. Go ahead.
You know, as you were saying that, I'm reminded of the director who used to be the head of the community outreach for the medical center. I know they haven't done a lot of outreach lately. You don't see them like they used to. But he was at a community forum in St. Martin's. He said he discovered one of his diseases by going to a screening. He said he had health care insurance and so on. But he said when he went to the screening and had his tested, he said, I didn't know I had that. You know, it was only by going there and being with other folks he did that. The second thing is Tuskegee had a great impact upon African Americans' reluctance to deal with some of the healthcare traditional folks because again, it traumatized us, and even people talk about it today and so on. The other thing I find sad, and I guess I will argue this when I worked at Douglas County doing racial equity and diversity work, I was surprised how many of those functionaries or government officials have never been in North and South Omaha. I mean, they get grant money, they give it out to certain friends of their families or whatever, but you got to get out of the community. And some folks are not going to drive downtown to engage with the health department official, whatever. They got to have a better outreach. And then the last point I think is important, going back to something you said earlier. May Griffin, who works at Tri-Faith, lived in Tulsa, Oklahoma, and we did a community forum over at Augustine Lutheran Church, and she confessed in front of the whole group. She grew up in Tulsa, never knew about the riots from 1921. So my point is, there's a lot of things in our communities that our institutions and government officials are not doing outreach and educating. And this is a good example of you got all these different health issues sneaking in. You wonder why people who are low income, people of color, die prematurely because we're wasting money elsewhere. We don't deal with it. We got a couple of minutes left, and I wanted, before we open it up, I want to ask you on this national level. I know we've been watching the two characters are running for president and so on, and we need advice on who to vote for in different districts on national level. What advice should you have about the caliber of folks running for office on various levels, and how can one decide, as Ernie used to say, vote for one rat over another rat, and so on? Again, some people are even want to stick out, don't even want to vote. So give me some advice on what we should do, Donna.
I'm riding with Biden
Okay.
because I don't feel that a person that's been convicted of 34 felonies at one sitting can represent my interests. There are probably a lot of people that he can represent, but I'm not one of them. Okay. I didn't like him when he had the apprentice show because I thought he talked down to people. But there are people who don't mind being talked down to. So I am very clear. If whoever the Democrats put forward, that's who I'm going with.
You know, as you say
Period.
that, I'm on the line, but it's a challenging issue. Again, we could disagree, as we say, you vote for who you want to. But I've met
You on
people.
the line. You on the line. What
No,
line?
no, I'm on the line on, is my vote going to really count if the person is not cognitively processing the situation? In other words, some of us even challenge what are the benefits from us at the grassroots level. In other words, we look at how does it help our community. And as someone who studies the demographics, as Glenn Freeman said to me one time, sometimes you vote against someone so you don't get someone in. So that's another reason I would vote not to have Trump get there. Plus, Trump has said enough and done enough stuff that he's already told you he's going to be a dictator and do some crazy things and yada yada. I'm just surprised that the Democratic Party still not dealing with it.
The trouble we're in locally is that there are people who didn't even know we've ever been a blue state.
So give me more feedback on that. Talk to me more, because some people are like, when did it
About
happen?
the governor, the senators, the mayor, they were Democrats. They don't even remember that. We have nobody in any position of power that could help us. Okay? Who would it be?
Today, you mean, or back in the day?
Today is what I'm talking about.
Okay,
Okay?
I got you. I'm following and tracking.
But it's okay because when I ran into a black lady who was getting signatures for voter ID, I knew we were in trouble then because I asked her, I said, I don't know you, but you don't remember poll taxes and literacy tests that our ancestors had to take before they could vote, and you're going to have a petition saying voter ID, and here we are. Here we are.
Yeah, that's a made up bogus. It's crazy how people can run with stuff and the data shows that it's not there. But again, there's so many people in our community and there's few doing the work for the many. It's obvious. And so again, I go back to look at people's mileage sheet. When have they traveled to that part of town? And I know some people have never, I've met with a person, Sean Kuhnfeld, who worked for she did diversion program, and she's doing that for years. And I asked her one time, how many times you've been in North Omaha engaging with families? She says, not once. I mean, you deal with families every day in your office. At some point, you got to track in their neighborhoods. I mean, like most of us professionals, we have to travel all over this community to work with the people. But again, I drop names on them because, again, if you don't expose the incompetence during the working hours, I'm not talking about their private life, but as a public official, they should be out here beating the doors down and doing things to help that. Before we move on to open it up, because we're already there, Donna, you have any comments you want to share with our participants before we open it up to people to give comments and push back at us or whatever they want to do?
I'm just so privileged to do what I do. I am blessed to do the work that I do, whether it's helping people get access to healthcare. We have a very small clinic in our building, and just helping people. I'm blessed to do that. And I hope that I've got enough stars in my crown so when I go, I can go where the good people are.
Good, good. I see one comment that someone threw out here. We can open it up at this point. If you want us to talk directly to Donna, just open up your mic and talk directly to her. Any comments you want to make. So, just go forward. Or even put something in the chat. You can put it in the chat and we could read it. Someone made a statement here. Yes, ma'am, we're at Mount Calvary Community Church, 5112 Ames Avenue. So apparently they must be doing some kind of a meeting or something related to prevention or health care that you alluded to earlier, Donna. I assume that's what
Yeah,
that's about.
yes, we're partnering with them.
Okay. Is this the first time doing that with them? Because I've never heard that they did. I know you used to be at another location back in the day when
It's,
I was involved with the group.
yes, and thanks to Mark Darby, I know he was one of the organizers of the effort. And so we have to work together and not have to ask the question, is it for my group or this group? If it's around healthcare, it should be for everyone.
Okay. Mildred asked me who can see the recordings or messages. They should be on where you can see all of it. They're out there in the chat. So we just have that. And it's also on Facebook Live. So if people want to watch it, and by the way, most people watch our programs on Facebook Live because sometimes they want to be caught on the Zoom, getting into some deep, heavy duty topics that are beyond the bell curve. But yeah, a lot of people watch it after the fact. And again, we post it on our webpage. So this is all public information. So we share with people what you say here doesn't stay here. This is not Las Vegas. I see another comment here. Maggie, did you want to say something about that? You want to speak out?
Oh, sure. I put it in the chat, but Dr. Polk, I just want to say, as a Nebraskan, how grateful I am that we have you as an individual, that we have the Nebraska Urban Indian Health Coalition serving Omaha, as well as, other surrounding areas. But I just think that you are an inspiration. And I'm grateful that you're speaking, that you are encouraging young people and educating them. And so I hope that you live to be 150 years old because we need you every single one of those days.
Maggie,
Well,
oh, go ahead. Sorry, go ahead, Donna.
Well, what I wanted to say was feel free to stop by and see us. We're at 2226 N Street in South Omaha, which is where we got our start. So we're back, and I welcome anybody to come see our beautiful facility. And thank you so much for your kind words, Maggie.
Yes, and it is a beautiful facility. I love it.
Maggie, did you want to say anything about your organization? I know we were talking individually here. Sometimes people don't do that, but do you want to say anything related to your organization and this topic? You guys do anything related to healthcare or anything? Or issues like
Oh,
this?
sure. I don't know if you're talking about the organization I serve on the board for,
Right,
or
the
the
board. All I know
organization that
about the board, the
employs
other
me.
people I don't count. I ain't dealing with them. I'm just about the one that I was associated with for 10 years. And your latest edition of your newsletter was excellent. I thought I wrote a couple of those articles. They're that good. As a matter of fact, I'm getting ready to write a letter to somebody saying, if you keep up that work, then I'm out of work and I can never write articles like that again. It was that good.
So
You have two excellent articles in there.
what is Maggie's organization?
I'm the board president of Nebraskans for Peace.
Oh, okay. All right. I know about them.
Yeah.
Yeah.
So we have three focus areas: anti-war, and anti-violence. Then, the one that I don't keep track of nearly as well, climate change and environmental issues. and then the one that is really where my passion lies, which is social justice. And
All right.
so we're trying to continue to lower the median age of our membership, because we have a lot of aging members, but we're really looking still to people like you, that have been doing this work for so many decades, that know how to do what needs to be done, and to make sure that in a lot of ways that history does not repeat itself, which is what I think you're touching on when you talk about a dictatorship under Trump. And I, of course, just like Ajmal did, and I don't think it's good to spend too much time talking about the election, but I do feel strongly that there is a lot of at stake here in our country.
Yeah, yeah. And the thing of it is, I had to go back in history because I knew a little bit about FDR, but he was in a wheelchair from 33 to 45, and he took us through a depression and World War II. So it's not that I am, put off by people who want to deal with the young, but I'm from a culture where the elders were revered, and we're losing that. Okay. And when you have people who weren't in the war, they don't know what the fight was about. If they did, we wouldn't have lost Roe v. Wade. Okay. We lost that because a lot of these young people have no idea why we had it to begin with. Okay. And now you wait, 2025, we're going to be in trouble.
Wow. Somebody had a comment here. I see one here that says, "Do you work with the Indian Center in Lincoln, Donna,
You know what?
or collaborate with them? Do you work or collaborate with them in Lincoln?"
Yes, we do. Not as much as I'd like to. We have a clinic in Lincoln, so we're providing access to healthcare down there. And I'm happy to see that it seems like they're going to be able to survive. Fortunately, they own the land that they sit on, and so I support everything that they're trying to do. Let me say it like that.
Donna, by the way, some of us don't have a clue how many Native Americans. I know in the country there's what, 1 or 2%. They're a very small percentage compared to the other people of color and so on. What are we talking about in Nebraska? What kind of numbers are we talking? Because you see urban Indians, and then obviously you have the Indians who live elsewhere. What kind of numbers are we talking?
Well, I don't think that Native people in Nebraska make up 2% of the total population.
Wow.
A lot of migration back and forth. People come into Nebraska, primarily Omaha, or maybe even Scottsbluff, Valentine, the border cities or towns. I reach out to them because from a political standpoint, we're in the Great Plains, and that's North, South Dakota, Iowa, and Nebraska.
Okay.
And so I'm involved in discussions with the tribes in those areas. There are about 17 tribes in the 4 states. And there are issues. We are being overwhelmed with methamphetamines. And that's another thing that I don't hear a lot about in the Black community. And I understand that cocaine is now the number 2 drug, and people are using powder and not crack. And the alarming thing about that is I believe I know of 1 fentanyl death from powder cocaine. So I just think that we need to talk more about what's killing us so that we can at least sound the alarm.
Wow.
And maybe it's being sounded and I just don't know about it. But I know that we're being overwhelmed with drugs, and we need to do something about it to save our own selves, not expecting anybody to save us, but we have to save ourselves.
You mentioned that.
Dr. Polk,
I was, go ahead. Did someone have something to say something?
I was going to say, your last words is very important. This is Cheryl Weston.
Carol,
I would like to piggyback off of what Maggie said. You are an inspiration, and you have always been there to help support me and what I tried to do. And I think that we are very blessed to have you. And I'm with her. Go ahead and go for 150. You keep on saying you're going to stop and you don't, and we're glad that you don't. You brought
yeah,
out several things tonight when you said like people don't, and that's our fault, is we are not taking care of ourselves mentally, socially, physically, or any of that. And we keep wondering why what's happening to us because we're not stepping up to the plate and doing it for ourselves. It seems like we're out there with trying to, somebody else is taking care, and that's what we stand and wait for. And in this election, and I don't want to get off into the politics, but this is very important election. And we are sitting here telling, well, I'm just not going to do this or I'm not going to do that. Like you said, the people don't remember when you did have a Democratic mayor, when you did have a Democratic governor, and you did have a Democratic senator.
yes.
And the Democratic Party here in Omaha, in Nebraska, is pitiful. If it isn't something they can say just 100%, we can get that position, they don't even fight for it. We have to start fighting for ourselves. Everything we have to do, we have to take it up and start fighting for ourselves. So I want you to continue. And like I said, you're very inspirational. I can talk with you. You're just there, and you just devoted to your position. And I know some people say, they say it to you, and you're like, "Oh, don't say that," and shrug it off. But it is coming from the heart, and we appreciate you.
Let me say something, Cheryl, and I'm so glad that you're on because I really can't see who is on and who isn't. But I went to the EPA meeting that was in South Omaha, okay? And it was about 2 Mondays ago.
Right.
And then they have one in North Omaha the following day. And it was at Metro, and they had the place set up for, I would say, easily 150 people. And they had translators. They had everything. I bet you there weren't 10 people there.
Exactly.
There weren't 10 people.
Right.
And they're back because lead only it only moved a little bit away. Okay. And every chance I get, I credit you, Cheryl Weston, for the little bit of money that was paid out of $300 million when they were here from 1999 to 2005 in North Omaha. If it hadn't been for you, Cheryl, that money to do the remediation would have went to New Jersey or Kansas City. Okay.
Thank you. I appreciate that.
Well, it's true. And I think I want to meet with you to talk about the advisory committee because they're going to have another advisory committee.
Okay.
But it's going to be different than it was back then. And we need to make sure that North Omaha is given the attention that it needs to get. Okay.
And the jobs, because if you remember, that was one of my big thing was the people who are most affected for this should be the ones that have the jobs.
Girl, I know.
So you let me know and I'll make it happen that we get together, and we do need to be on that advisory so that we don't let this go.
We need to form our own advisory group. So me and you will talk just in case.
Well, you keep up the work, and like I say, go to 100, at least 100. 150 if you can, but at least 100.
Wait. Why you give out this 150 to her? Give it to the rest of us. We want to live forever. What do you think? Anyways.
No, I can't say it on for everybody. I can say it about people I know. what they've done, you're not gonna say it. So, and you, Ajma, I
Wait, hold
definitely
it,
won't
hold
put
it,
it in
hold
there.
the host. Don't be taught the host. He's here. Hey, I want to switch up, and I know we still got questions here, but one of the things I was going to ask is, Donna, how do you help people get involved, particularly people who don't know? What you just got you saying we'll start a advisory group. What are some other things we can do to get involved to help our community?
Man, it's tough because you have to have a passion for the work.
Okay.
There are two types of people: the people that are passionate about issues and the people who work to fund their passion. And so then it's like leaders. You can't make a person be a leader. Leaders are born, okay? And so it's hard. And a lot of times you're out there by yourself because people now are at home watching Facebook Live, I guess, when they should be at a meeting. No, I'm serious.
Right, I
People
understand.
go to funerals because you can live stream them. Come on
Right.
now. And so we have to work around that. We have to figure out what is it going to take. Now, if I had $320 million, I tell you what I would do. I would pay people to get out there. That's what we did, Al Jamal,
Right.
when the health department was not testing people, and then they weren't vaccinating people. We paid people $25 to get the COVID test.
Wow.
We people $25 to get the vaccine. Okay? That's what you have to do.
Wow.
But that's why I didn't get none of the 320 million because that's what I would have done. Paid people go door to door sounding the alarm.
Wow.
We're okay.
No, I hear you. I'm listening. I'm tracking, and I agree with you on the passion. So I did one of the little things I want to share is I went to my first Amal Public Library board meeting. I've written to them before. They didn't write me back, so they had one of the Abraham's Library, which is near my house. And it was the first time I've ever been to a board meeting of the library, and they had three African Americans. And some of the things I suggested, they hadn't even talked about on a decent level. They haven't implemented. But my issue is that libraries should be the most sought after place in our community, particularly if our education system is the best. Secondly, we should be reading books all the time, reading articles, and we should encourage more library use. And again, they're building that new library, but we're going to have libraries that are different than the past. But yeah, going to meetings, engaging people is different than just sitting behind a screen or writing a letter. You got to do all of the above. So I really appreciate and agree with that. But other feedback, other reactions. We got about 10 minutes left or so, 12 minutes or so. Other reactions, other feedback. I saw somebody wrote something in the chat here. Someone said, I think it was someone said, yeah, they diddled something you said earlier. That was it. Cut off their face in
But
spite of their face. Yeah, yeah.
I just want to throw another thing in, Ajma. You talk about the reading, and I did notice on your website too that you've got reading lists and reviews. But if our children aren't being taught how to read, how can they read the book?
Yeah. Literacy rate is
So,
an issue.
literacy is a big problem in our community.
But let me say this: my grandmother taught me how to read. I had a library card when I was 4 years old. We cannot depend on people to teach us the basic things that
Right.
we need to know. We don't. And people, if you can tell if a person reads because they're literate. You can tell a person that doesn't read.
Yeah.
And so we have to take on that responsibility ourselves by giving kids an incentive. Let's have a little reading group. We have a group that meets. Is tonight Wednesday? Oh my
Yes.
goodness. See, because our youth group meets on Wednesday, and tonight was family bingo night. And so they play bingo and get little prizes. But yeah, that's what we have to do. We can't depend on people. And Cheryl, because you brought this up, I can remember when OPS was in the top school district in the state. It ain't even in the top 10.
Wow.
Central High School was the #1 high school in Nebraska. It is not in the top 10. You know what schools
Right.
are in the top? Elkhorn.
Yep.
Okay. What does that say to you? And
Wow.
we have nobody to blame but ourselves.
Exactly.
We
I
can't
agree
depend
with you.
on
That's
people to teach our kids. We need to teach
Teach
them.
our kids, just like we need to teach our kids culture and everything. And I'm not gonna, somebody else might have something to say, but just like Juneteenth, it was important, and I put out all the flyers and stuff about Juneteenth, but what are we teaching our kids about Juneteenth? Not just a celebration. Why are you celebrating? What was the purpose of Juneteenth? We don't teach that. We're not teaching. We're still waiting on somebody else to do it for us.
Y'all say that. I find it painfully sad that we as a community moved away from what we were when we used to read a lot, and we got educated because it was against the law to teach us how to read and write. And again, there's another person in this process who teaches at the university, aware of it. But when I was teaching at UNO and UNO Methodist College and Metro, I could tell the readers from the non-readers. And again, there's a way people who read. Again, I'm not against oral tradition, and you can pick up knowledge. Malcolm is a good example. He was not a great writer. He didn't write. He was a great speaker, but his knowledge was there. But my point is, some people won't even read the assignments. And even when you give them extra credit, they wouldn't do it. And then some expected free grades. And so I look at a whole group of folks who get microwave education. Again, when I debate or talk about articles or scholarly pieces or anything, newspaper articles, people are not reading. We have to read more if we're going to learn about what happened before we got here, and particularly if we don't have grandparents and older people who give us the history of the knowledge of what we encounter and how we have to overcome what's going on. So yeah, those reading is extremely important. And as what's that expression? Once you get knowledge, they can't take it away from you. So yeah, we got to push that even more so. And again, when you look at these school systems, as you both alluded to, OPS will not give me any of the data on the achievement levels between race. You ask about some of this information, and they won't share it. And again, why are we paying taxes when they won't tell you the disparities or what's going on with these kids? And if you look at the university, they're not doing well.
You can go onto their website and the reports are there.
The OPS or the Department of Education?
OPS.
I did not know that. I've been asking for data.
By race, the achievement levels by race.
Oh, I didn't even know they had that.
Oh yeah.
I knew education had in Lincoln, but I didn't know OPS put it. So every year you can see how Black kids or Native kids are all doing in those various school levels, or is it just the test and the grades? How do they do that? Composite.
They will tell you how many kids by race are in the grades in OPS. Just go to OPS, look under reports, and you'll see what you're looking for.
So do they have graduation rates by race? Do they have achievement levels on the exams, like the achievement, all that?
They have truancy rates, graduation rates, all of that.
I got to track that down, because I know whenever I write to Scott Smithsborn or call him, he's never in, he never responds. I drop names because, again, if I'm going to write you a letter, you should at least respond when you get taxpayer dollars. But good, thanks for sharing that. I'll follow up on that. Other feedback, other reactions. We got about 7 minutes left or so, right around that.
Well, let me say this. I'm making an announcement. As soon as I can figure out how to set up a podcast, I'm going to have a podcast called Grannies. So I can just talk about how grandkids don't pay attention to me. Okay?
Somebody says that we need to update our teaching of Black history in the schools. There's so much misinformation that our children would benefit from if we were taught. Have any of y'all, either one of you, anybody talked in the Black studies, or do you get a chance to go talk at higher education about Black culture, anything like we were talking about? Do you get those opportunities in our schools?
I have been doing that for a number of years. At Wesleyan, I taught culture at Southeast Community College. I taught at the College of St. Mary's. I taught culture. I've been able to teach culture classes in Nebraska State Penitentiary System. So I have done that. I've been very fortunate to do that.
Good. Yeah, I'm always trying to say how you can bring people from the community to these academic settings, and particularly people who are not from Nebraska, who can learn about the contributions that Nebraskans have made to the community and to the world and so on. Other feedback, other reactions. We've got about 5 minutes left, and I'm going to kind of give a few more before I make my closing comments. Anything else from someone who's been quiet?
And I would say too, if anyone is really interested in knowing more about Native Americans in the Great Plains, I have 2 excellent staff people that would be very happy to come out and talk more eloquently than I can about it. So just, and it won't cost you anything. Just maybe a sandwich and some water.
Wait. I want to come and talk about the sandwich. I like to get a pop instead of the water. Okay, go ahead. Other folks, we got about 4 or 5 minutes left or so, 3 minutes. One of the things that, well, let me say this before we close. One of the reasons I invited Donna on there, she knew my mother, Lurleen Johnson, and worked with her back in the day. And my mother was involved in the desegregation of Omaha Public Schools. Those 7 women sued the school district for racial discrimination, segregation, and they won the case. And so Donna's been back in the day. She knows Mrs. Charlotte Sharpshire and all the folks they did with Mothers for Adequate Welfare. So I've been knowing Donna for well over 50 years in terms of the work that she's been doing. And like I said, my mother started me off on this, being an advocate. And the thing that she used to always say to us, help the poor. We come from a family of 14 kids. And so even though I would stay home and babysit, she was always pushing us to do other things. And I tell people the reason I joined the Peace Corps, because she said also do what you can after you get your college degree. And so those are the inspirations, as you said, Donna, earlier, your grandparent helped you. I would say my mother was one of them. But the other thing is, I seen her make a grown teacher cry, a man, when he made fun of my hair that was cut off bald, and she chewed him out in front of the principal. He apologized. And I never forgot that incident of seeing my mother stand up to this guy who had a college degree and speak out for her child, and she did it for other children. So not to spend less time on my mother, but again, there are many mothers out here fighting fathers for their kids, and we have to bring them to the forefront. And I'm not going to mention any names, but Judith Hill said one time to me, you can't come to my child except through me. Sometimes people want to hijack our kids. And again, we need to talk about families and helping our families. So I really push and really appreciate the work you've done, Donna. And you're probably one of the longest serving advocates that I know out here. And again, most times we get to a certain age, we just retire and just go sit around and watch TV and play Bid Whiz and Tonk and all those other things instead of giving back. And particularly if we're getting Social Security checks and monies where we don't have to work. And again, some of us have to go and stand at Walmart. But again, if we can, let's give back, and regardless of our age. And as Senator Chambers said one time, when Father Time catches me, I want to be in motion. So really appreciate that. We're right up on our time. Any other last closing comments, Don, before we finish?
No, thank you all. It's been a privilege to talk with you. And please don't forget about me, no matter how old I am. I'm still going to be out there trying to do what I do best.
Good.
Thank you. It was an honor to spend the hour with you, Ajamal.
Thank you. One last closing comments, and we always say we're going to have a number of series of guests, and we're going to try to put our guests on our web page and Facebook page well in advance, because someone gave me some constructive criticism, said you don't send things out the last minute, and sometimes it's not always posted. So we're going to have Wachelle Davis talk about voter registration engagement. She may talk a little bit about some of the issues of returning citizens who get out of the prison, as some call them ex-cons and so on. But we want to have her talk about her work in that area of getting people to be much more politically or socially astute with our elected and public officials. And some people don't know that when you get out of the institution, Department of Corrections, you can vote. I mean, people don't know that there's not that lag time now. And so the Department of Corrections doesn't do a good job of advertising that, nor any government state institution. So that's one thing. We're going to have Elijah Ali, who's a longtime community member, who's up in age. When I say up in age, he's been through fire and helping our community. And he's going to talk about racial ethnic disparities. He's done a lot of work with DMC, Douglas County. He knows that, he says, we're on facing a genocide. He's really adamant about some crazy things that are going on and locking up these kids and adults and convicting them of crimes like adults. If you have a gun, they treat you almost like an adult and put you in jail and keep you in systems twice as long as white folks, young white folks in the same system. He'll talk about that. And then we're also going to bring some other people on. We're looking to bring people on who are in the know. We want to drop names. We don't want it to be shy. But again, you're not going to have these institutions improve themselves unless you call them out and call them in. So our goal at Moore and elsewhere is to bring some very provocative people. And again, with freedom of speech, and if Trump can get away with what he said, surely in Nebraska, we get to do the same thing. So I appreciate y'all all joining us today. And again, we hope that you join us next week when we do another program and so on. And as we always end, may the force be with you. Baroko.